Light punch. Light.
So, hello everyone. In today's Sci Talks session 2, we are with Dr. Abhirami here. She is our guest speaker. Dr. Abhirami has done her bachelor's in homeopathic medicine from Sairam Homeopathy Medical College, and she has done her master's from Tamil Nadu Open University. She has been an executive member of Indian Homeopathic Medical Association from the year 2019, and she has presented a paper in National Journal of Homeopathic Sciences about homeopathy and its role in post-traumatic stress disorder. And she holds an expertise in infertility, dysmenorrhea, and reproductive health in females. And currently, she is a senior consultant, homeopathic consultant in Dr. Kushali's homeopathy clinic. So it's a pleasure to have you here, ma'am. Thank you so much for being with us. So the stage is all yours. Can you please start?
Yeah. Thank you, Dr. Ashriya. This is a nice lesson too. Uh, Thank you for the experience too. So basically, the today topic is like anxiety management. So nowadays, the anxiety is being like a taboo. You can say like a buzzword. Okay, so everyone says like I have an anxiety. I have a complaint of anxiety. So what is anxiety actually? So before going into what is anxiety, we should know three terms: fear, anxiety, and anticipation. So these three terms are interlinked. We should know what is fear, what is anticipation, what is anxiety. Because people and person coming to our clinic are telling them that I have an anxiety. It can be because of a fear or it can be because of an anticipation, but they're telling name as anxiety. So basically, what is fear? So suppose I'm giving an example. So if suppose you have an exam tomorrow, you are just preparing for the exam. So you have a fear for it. Like I have an anxiety, I mean, I have a fear. How will I perform the exam? So maybe it can be previous experience of past experience of some difficulty in the examination, which creates a fear, or it can be because of an anticipation, like previous exams, which creates the anticipation also. So to differentiate these things, first, before going for an exam, I'll have some symptoms like a dysman. I mean, like frequent stools, frequent things. One second. Okay, sorry. So basically, first fear is, so if you're going for an exam, past history of fear, past history of difficulty in moving exams, so that it ends up in fear. And anxiety is something you have an exam tomorrow, and how will be the exam tomorrow? How I'm going to perform exam? How is the difficulty with managing exams? If I fail in exams, what I'm going to do? If I'm going to um, if I'm going to miss something tomorrow, what I'm going to do? This kind of thought process comes under anxiety. Our anticipation is something. Tomorrow I have an exam. I have to prepare it for an exam. So I have to prepare. This is an anticipation. And fear, there is a past history of a difficulty in performing the exam that is called as fear. So when these three things are different and when they express things like an anxious things, as an anxiety word. So fear is different, anticipation is different, and the anxiety is different. So we need to understand each terminology differently. So
So,
why
ma'am, in a
do
nutshell, if we differentiate in a short term, fear is something that
mm,
you know that it is going to happen, an incident is going to happen, and that you have
mm,
have in mind. So, anxiety is
mm,
something like a chain of thoughts which comes along
mm.
with it. You build up a own castle saying that it will happen, it will not happen, and all these things. So that becomes anxiety. And anticipation is something that you are prepared with. A thing is going to happen, and you have prepared with it, with no extra chain of thoughts. This is my
Yeah,
understanding in a
exactly.
nutshell.
Yes, exactly, exactly. This is what that thing is. So why I'm telling this thing is, so for entire thing, it cannot be concluded an anxiety. It has a different terminology as well. So even other system of medication, when we started giving medication, we need to give some medicine to keep all the things calm. Fear and anxiety as well as anticipation is something related with the mind. So keeping mind calm requires some medicines which keep our mind calm, but not in homeopathy. We have been dealing with these things differently. So we'll be asking the questions which is related to fear, why it is happening. So we need to ask, are we asking, probing the questions in different manners, whether to understand it's an fear or anxiety or anticipation. So if you have an anxiety, so this is an anxiety, okay. So whether I have an anxiety, yes, definitely we need to analyze it. So if you have an increased heart rate, increased palpitation, like once you lie down in the bed, you have a thought process or something is going up and down, or some heavy chest feeling, or something is happening. I don't know what is happening. I am unable to sleep. So what I'm going through, these kind of symptoms will start develop. So there are different traits. How we say for autism, we'll be telling the spectrum of autism is a group of spectrum, which is a different kind condition has autistic sphere. Similarly, anxiety is like the spectrum. So anxiety has a different, different psychological disorder has and anxiety. At one point of the time, they exhibit the symptom of anxiety. For example, generalized anxiety disorders. These are the different types of anxiety disorders where they exhibit the anxiety symptoms. So generalized anxiety disorders is like common disorders which where the patient is anxious to everything. They are unable to think about it, and they have a palpitation, and they have and sleeplessness will be there. So they feel some uncomfortable things are there, and fatigueness is there, muscle tension will be there, and sleep disorder will be there. These are the generalized anxiety disorders. When coming to panic attacks, panic disorder also will exhibit the symptom of anxiety. So panic attack in sense, suppose you have a sudden attack of something like a sudden diagnosis of something, a sudden incident where you face the accidents incidentally. So these kind of things which develop a panic attacks. So in case of panic attacks, also you have a sudden high heart rate, palpitation will be there, sudden outburst of emotion will be there. Sometimes the patient tend to move away from the entire environment. They will not be socially mingled. So because of the panic attacks, they panic sudden incident of sudden stress, they'll be moving away from things. So these are comes in the panic disorders. And social anxiety is something when they go for outside, meeting new peoples or meeting a crowd. So where they tend to have a social anxiety. So they avoid mingling with the people, and they'll be highly nervous, and they'll be shivering, and they tend to have some other symptoms of like stomach upsets also, like a stomach, frequent stools, frequent bowel habits, frequent urination. All this will be there when meeting to new people. So they tend to avoid this kind of symptoms. So that they will not expose to this kind of anxiety. So they tend to avoid these things. And specific phobias like fear, some fear of heights, fear of flying, and crossing roads sometime. And these things will come under specific phobias. So they will also exhibit some kind of anxieties. And acrophobia, like a fear of in a closed space, when going out, they feel comfortable. In a suppose in a crowd, they feel very suffocated and shortness of breath will be there. Immediately, as soon as they go out, they feel comfortable and they feel better. And second, one more thing is the PTSD. PTSD like post-traumatic stress disorder. PTSD means like after a particular event, a particular trauma, they tend to develop these kind of symptoms. So PTSD like after a particular event, they will tend to have an avoidance behavior. They will also exhibit a symptom of anxiety and separation anxiety. So like between mother and a child, or between a two individual when they are separated, they tend to have a anxieties, and they exhibit as a nightmares, and as well as they have a fear of being alone, and things like they need someone next to them, and they will constantly brooding about them, the next one, whether something's happened to them. So this kind of anxiety will start developing. This is the different spectrum of anxiety where they tend to have an anxious symptom at any point of our life. So everyone in the life are facing some kind of anxiety. So managing anxiety is a person who is going to succeed. Those who know to master the anxiety will succeed in their life. So everyone in the life has an anxiety. So we need to know how to manage the anxiety. So before going for managing the anxiety, I want to discuss about certain things. Mm, these are the common symptoms. What I tell, like a palpitation, heart rate, and isolation, avoidance behavior. These are the common symptoms. So, how do you know? How do I know where I have an anxiety? How do I know whether I'm anxious and what phase of my anxious? Whether I can manage it at home or whether I need a professional help. So first thing is anxiety has a different phases like a mild anxiety, moderate anxiety, severe anxiety, or it could be the panic attacks also. So mild anxiety is something which is manageable. So every individual, as I mentioned, every individual has an anxiety phase. So as soon as once you have exposure to something which end up in anxiety, so you know how to manage it. It doesn't disturb you physically or emotionally, or it doesn't develop any kind of symptoms functionally. That comes under mild anxiety. You don't need to bother about it. Once you are exposed to something, you're definitely going to get better. But in case of a moderate anxiety, like you have increase in heart rate, palpitation will be there, avoidance behavior will be there. This is negligible avoidance behavior. It's not like a super avoidable thing, but it's negligible avoidance behavior, palpitation, and you feel something is bothering you emotionally. And you might feel some structural symptoms also, like uh, mm, frequent diarrhea or something like that. Systemic disorders, like I mentioned. So systemically is that it can also exhibit some other symptom also. So that is a moderate anxiety. But severe anxiety is something you not even think about it, constantly thinking about, keep on thinking about the situation and keep on uh, overthinking about the situation. That comes under the severe anxiety. So in severe anxiety also, there will be complete avoidance will be there. They're not unable to think about it. The heart rate will be highly in the super range of above 100, and severe palpitation, unable to sleep. All this comes under severe anxiety. And panic attacks is a sudden thing. So sudden thing in sense where they are exposed to the particular event, they start to develop all of a sudden they have some develop this kind of a symptom that is comes under sudden thing. So they completely avoid the entire exposure with the social communication, and they keep on thinking about the things and keep on worrying about the things. And after the stress event, the entire personality will be different. So if this is the stages of anxiousness, if in case if you are in a mild anxiety, you can manage by yourself. When in a moderate and severe anxiety, you can try yourself to come out of it. But if it doesn't come out of it, definitely you need the help from others. So maybe you can ask for the professional help, maybe a psychologist, or you can go for some other person where you can keep yourself better. Even we can home with the homeopathic medicine also we can help. With the panic attacks also similarly, we try to overcome it with the things what I'm going to tell in future. But if you're not able to do that, better go with the professionals because it should not damage the further thing. So why I'm telling is hypothalamus like in a brain is something which controls everything. So when there is a disturbance which is there and emotionally, it's going to disturb other parts also. For example, so hypothalamus is something which controls your appetite, thirst, and your hormones also. Even your stress levels. Cortisol also controlled by the hypothalamus axis. So if there is any disturbance in there, immediately the thirst and appetite will becoming low. When the appetite and thirst is coming low and genders are getting low, you should be aware that something is going wrong in your body. So if it is going wrong continuously, at one point in time, then the stress hormones will be very high, and there's a hormonal changes. Females also there will be hormonal changes as well. So that is need to be considered. So progression of something is better than going immediately and take something at initial stage itself. So we need to know how to balance that also. So we need to understand which phase of anxiety we are. Okay.
Exactly.
And yeah,
Ma'am,
please,
one
Dr.
question,
Ashna.
sorry to intervene. Um, I have a question that
Yeah.
in children, is there only
Mm.
separation anxiety, or child can face any like other forms of phobia and all these things, or the child will only
Yes,
have
yes,
anxiety, separation
yes,
anxiety?
yes. Yes, they can also have other kind of phobias also. So child and adolescent period is a period where they tend to develop the anxiety episodes. This is the first primary phase where they tend to develop anxiety. It because of separation or it because of some exposure of something like something a sudden fear, as I mentioned, the panic attacks also. Sometimes when they have a when they're emotionally depressed or any sudden emotional suppression, they tend to have developed these kind of symptoms, but in a gradual manner. So once, as a child grows older, so once these kind of symptoms is gradually developing or tend to have an anxiety peak at one point of the phase of the life. So all this is started. The A of the anxiety will be starting, especially with the child and with the adolescent period, because of some other predisposing factor which is happening in our environment.
So, are there a chances that child will develop anxiety from parents? Is anxiety genetic?
Yes, yes, yes. So, to be frank, this is a very good question. So, there will be a genetic relation with an anxiety. When I refer many things regarding with the genetics and anxiety, so I found that there is a study with the YAL, the University of Psychologists. They have a performance study. In that 1 million people have they have undergo a study of 1 billion people. In that, 100 plus genes are present with the persons are representing the anxiety. These genes are also presenting with a person with depression, chronic pain, and gastrointestinal symptoms, disturbances, I mean disorders. So these kind of symptoms also developing the anxiety because the gene representing the anxiety as well as the depression as well as the gastrointestinal symptoms as well as the chronic pain or the same almost the same gene. So though they have a gene, the predisposing factor is the main important thing which is performing them to have a anxiety. So predisposing factors is something which is highly important to represent anxiety because everyone is going to get the gene. Only when there is a predominant predisposing factor, they tend to develop the symptoms. So we need to understand the predisposing factors. So we need to give a medication for the predisposing factor to calm down. So then only will be that will be good to take care.
Thank you, ma'am. Thank you for clarifying.
Okay. 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 So and when discuss about the anxiety, generally as per the WHO, it is more common in females than males. So though we explained that social anxiety is more with both genders, but females that tend to have a little more anxiousness than men. When I start to read about it, when I come to know that estrogen is something which is the key for the anxiety. Okay, because as I mentioned, child and adolescent period will have the estrogen, I mean, especially with the females, estrogen insufficiency will be there because they are not established with a flow. Then there is the insufficiency. They have tend to develop this low level of estrogen symptom, especially with anxiousness, unexplained emotions, starting cries without reason, unable to sleep at the night. So all these kind of symptoms will develop when there is the estrogen is insufficient or estrogen is very low. At the same time, people with the perimenopause and menopause will have a estrogen fluctuation. So when there is a fluctuation in estrogen, definitely they will also going to exhibit the same, that low level of emotions, unexplained emotions, sudden outburst of anger, sometimes fear of some fear without any reason, unable to sleep in the night, constant palpitation, sweating profusely. Something is moving sometimes. They mention that something is there inside. I feel very hot. So these kind of symptoms will be exhibited when there is a low level of estrogen. So that is why females are tend to have a little more anxious episodes and anxiety than males. So
And
even
obviously,
and
female always has many phases in reproductive life. She undergoes
hmm,
menstruation, she undergoes pregnancy, and menopause. So all these things come up. So that's the reason why females tend to be more anxious and more depressed because of these things
yeah,
underlying. This is a
hmm,
pathophysiology behind anxiety and
yes,
etc.
yes. So, so every female is going to have this kind of a disturbances, especially with the hormones. So, female has to understand what is happening to their body, and they have to try to control it or try to manage it, not to control. They have to manage it. At one point of the time, if it's going beyond the need, a professional help to come better.
That's right.
Hmm.
So can you please explain us some of the techniques, ma'am, with which we can manage anxiety at home or
Definitely, and
whatever we
hmm,
can?
yes, definitely. So, first thing is um, you have to understand your breathing. So, anxiety is something, technically speaking, it's because of a sympathetic nerve action, hyperstimulation of sympathetic. When we have to arrest it with a parasympathetic thing, parasympathetic action. So, that is like opposite thing. So, what we can do is start breathing. So, just listen your inhale and exhale. Just listen your breathing. Second thing, understand why it is happening to me. First, understand the reason. A gradual analyzation of what is happening to me. So, suppose if a person is getting admitted to the hospital and you have been very anxious about the situation, just think, analyze why I'm getting anxiousness because of this hospitalization. What is the positive outcome? What is the negative outcome? How can I manage the positive outcome? How can I manage the negative outcome? So once you have the thought process, you will get into the plan. So this is how I'm going to be. This is how I'm going to be. So when you get a plan, you're able to manage things better. One. Another thing is suppose this is a take it as a square. This technique is like a box breathing technique. Like just you have to do it for at least 4 to 5 times in a day to mean in an episode when you're ending up in anxiety, just do it for five times, minimum 5 times. Just inhale for 3 seconds, then hold it for 3 seconds, and exhale for 3 seconds, and hold it for 3 seconds. Okay, so you have to repeat it for 4 to 5 times. Just inhale 3 seconds, hold it for 3 seconds, exhale 3 seconds, and hold it for 3 seconds. You have to repeat this. So once you start to listen about it, listen your breathing, you tend to have this calmness. There will be a calmness in mind, and that anxiety episode will come down gradually. Other techniques like if you're in a highly anxious in a place, so just look after around this method is called like 3-3-3 method. Like just look after three objects, whatever you see in our look after that. So suppose you have to see for a bottle or something like a bag as some structured toys also. Look after that and think about the texture of the object and color of the object and sorry, the properties of the object, and think about the three hearings, three noises around you. So it may be a child cry, it may be a phone ringing, or it may be something which is there around, talk between some other person. When you are listening to that, you have a complete distraction of what you are going through. And next is like um, you can feel the textures of a body. You can just feel your watch. You can touch yourself. Again, three parts of your body, three places you can feel, you can hold a table, you can hold a pen. Just three things you can,
Tactile
you can touch
sensations.
and see. Yeah. So when you have three things like a sensation and when you have I mean, smell, I mean, hearing something on you and your perseverance of objects around you. So the three things which will make you better with an anxiousness. So basically, that is the thing to get a distraction. And generally, when you have you are prone to get an anxiety, make it your life to be easy lifestyle and healthy lifestyle, like up to I mean, sleeping at time, taking good vegetables and proteins, and do things in a punctual manner. Like people who have an procrastination or tend to develop the anxiety a little more because they're doing things in a hurry in the last minute. Already they are anxious. When doing things in a hurry, again they're going to miss the things. So that has to be maintained. And with the children, they develop an anxiousness. They are prone to get an anxiousness if they are a pampered kid or the highly strict parents. They tend to have a anxiety. Again, these kids are nowadays they have a good screen time. They have been using the mobile phones. So when they have a good screen time, they will start to develop this kind of anxiousness, especially when they are playing. They're playing with a temple run, something is means snatching from the behind, or they have to do something in a timeline. That tends to have that tends to increase the anxiety basically. So playing games is fine, but it's not actually advisable, but for a short duration of period it can. But when doing things to be done in a particular time, forcing them to do something, and this kind of things will gradually start to develop an anxiety in future. They'll gradually develop this kind of suppressed things and they develop in the anxious in future. So we have to monitor that also. So if you are trying to control things with these things like a box breathing or breathing techniques, or you're going to maintain with a analyzation, or it may be because that a proper healthy diet and all the things you have done, I mean, you did all the things in spite of that anxiety is not getting better, definitely is going to need a professional help, because this will also goes for the if until the anxiety is going to be in a functional state like increase in the heart rate, pulse rate, and palpitation, sweating, until it's going to be a functional symptom is fine. When it's going for the structural and the destructive thing, especially with the irritable bowel disease and ulcerative colitis, all these things are because of the anxious things. Constant irritation of your gut will develop these kind of symptoms. So before entering into something pathologically, we need to address something in the functional state itself. So if you are trying to control it with a home thing, if not, go for a professional help. That would be better.
So, ma'am, going to your specialization, can you
Mm.
shed some light on what homeopathy can do and as a benefit to people who are anxious?
Yes, definitely. So as I mentioned earlier, so once the consultation with the patient, so we will try to understand exactly what is it, anxiety or a fear or anticipation, what is exactly. So we'll be asking the questions. We'll try to understand the causative factors for the thing. Either it may be whatever the predisposing, as I mentioned, the predisposing factor, we'll be asking the questions. So, at what point of the time we started developing the anxiety? So, we'll try to understand the predisposing factors. Second thing is the reflection or expression of the anxiety, especially with especially with the patient, whether the anxiety is developing. I mean, before the anxiety, is there any other symptoms like palpitation, or the anxiety is developing from the abdomen? Some people tend to say, I have anxiety, I start with from abdomen. Some people will say, I have from the chest. Some people say, something is moving inside. Some live object is moving inside. I feel something is crawling inside. So these kind of symptoms will develop by the person. So we'll try to analyze the first, because these gives an important things for homeopathy, and as well as expression of the anxiety. So once you have an anxiety, when you have something to be present, when you have something to be feared, and you are present in someone, for example, I'm telling. So if you are presenting someone in front of someone, before presenting, I have a tend to have a frequent stools. That's frequent stools, frequent peeing, and frequent headaches. All these kind of symptoms. If I'm going to present something, if I want to meet someone, I will start developing this kind of the symptoms. So definitely, these kind of uncommon peculiar symptoms will be taking it, and we'll be prescribing the medicines. So it's not something like um, we'll be giving medicines for mm, uh, to keep the mind calm or to reduce this level of anxiety temporarily, or it's like something we are prescribing the medicine based on the symptom similarity so that the immune system is adapt to the particular predisposing event. So especially with the, for example, for the menopause women, the hormone fluctuation is going to be there till the menopause. So we'll be maintaining it for till the menopausal phase. As once the menopausal phase is get over, definitely they're going to get recover and improve. So this is how we treat with the homeopathic medicines.
So in this case, anxiety is curable for lifetime, or it will be recurring at some point of time. Because this is a
Definitely,
common
it
question
is.
that we get in our daily life, in our daily clinical practice.
Yes,
We tend to get
yes,
this
yes,
question that
yes,
we have a complete cure for this, or it will be recurring again.
yes. So actually, with the patient, we need to understand that. I mean, as we mentioned earlier, we have a gene. Everyone is going to have a gene. Until the predisposing factor is getting better, it's very difficult to say the word cure or is recovery. Definitely, we can manage without any side effects with the homeopathic medicine. We don't have any side effects with the homeopathic medicine. Definitely, we can manage. But when it come to the part of a cure or it's like a complete recovery, we need the predisposing factor has to be go off. So that is how the treatment should be. So until, if, for example, like I'm going to be with my mother, so till my recovery of my mother, till treatment of my mother, you will definitely going to get anxiousness in the hospital environment. So once you come out of the environment, it definitely going to be get better and complete recovery. So we will be giving the medicines to get better with, I mean, to get better with an anxiety. So recovery is up to your hand
Yeah,
with the patient.
that is something, yeah, really acceptable.
Hmm.
So I think I have clarified my doubts, and I don't think we have got any more questions from the viewers.
Yeah. So two things I will conclude with this. So as mentioned, so we know if some pathologically structural deformity is there, for example, a fibroid, or it may be a something which can be visualized externally, but anxiety is something which cannot be visualized. So how do you know that whether you have an anxiety is getting better or the same state? So we'll be analyzing with the different scales, different questionnaire we'll be giving to the person, like DAS 21, GAD 7, the generalized anxiety disorder 7, and Hamilton anxiety scale. These scales will be given to the patient. So once they have been filling with filling with things, so they'll come to know where they have an anxiety, to understand them where you have an anxiety. Second thing, for the prognosis. So for the previous visit, we'll be seeing the something like regarding anxiety. They may mention that the total score is a 36. When come to the next review, it's definitely going to be 25, 24. This is how they're getting better in every review. So we need to understand it physically also. So with patient will say, I definitely I have an anxiety for a long time. Even now I'm getting anxiety. With the medicine also I'm getting anxiety. All the things will be there, but structurally when you maintain a chart like this, definitely that will be helpful to understand the person. One is to understand and for the prognosis. And we have homeopathic medicines. Why we are specially is two things. Anxiousness is common everywhere, but we'll be asking when you are anxious. So there are certain things in we have a repertory, like something, some book where we used to have some medicines, a group of medicines. So anxiety before menses, anxiety in group crowded places. We have a medicines for anxiety in crowded places, anxiety before menses, anxiety of being alone, anxiety of being with people, anxiety of walking, anxiety of waking. All these symptoms are we have the rubrics.
Something very difficult which we
Those,
studied in
yeah,
summarizing and differentiating that.
yes. Yes. So everything has mentioned that estrogen insufficiency is there. Obviously, you're going to get an anxiety during sleeping. This is going to be there definitely. So everything has a pathological relation also. When all those rubrics is not simply given us as a patient words, they also given us pathological. They have a pathophysiology of each symptom also. So we have a different rubrics. Like person may have this feeling, uh, what is why am I going through this? Only that this whether I should say this symptom, so someone will judge me. These kind of will be there. This kind of things will be going on in the person. These kind of things where the anxiety is there, uh, they are unable to explain what they are going through also. So in that such case, they need to speak out. They need to speak out. At the same time, they should know uh, mm, this can be seems like a joke for others, but this is more important for the homeopathy physician. So whatever the things which makes an anxiety, some people will say some mouse are running under my knees.
Yeah.
I have an anxious that I have some mouse are running under. It seems like a joke for others, but this is an important thing which they are actually going through. We need to understand from their perspective. So we have a very good medicines for anxiety when they have such thing differently. The people has to come out and speak about it, then only we can give our medicines from that.
I think with this we can end up our session.
Yeah,
Uh,
yeah.
Further questions on my screen. Okay. So thank you so much, ma'am, for being with us for your precious time and giving us detailed scientific background behind anxiety, the reasons for being anxious, the levels of anxiety, and all these things, which are not commonly told in any of the sessions, I guess. So that was a detailed breakdown. Thank you for such an eye-opening session, and I hope we'll be having future more sessions, more eye-openers with you. Thank you so much, ma'am.
You're most welcome. You're most welcome, Dr. Ashia. And Dr. Ashia, I've been knowing, I knew you for many years, but this is a wonderful opportunity for me to express my thoughts as well as my understanding to the public as well. So thank you for the opportunity for me. This is a very good opportunity for me to express something from my as a physician, as a doctor as well.
My
Okay.
pleasure.
Thank you so
My
much.
Thank you so much, ma'am.
Thank you.